Good evening and happy Memorial Day, and welcome to another episode of Fresh Natural Live. We have a great show for you tonight. We're going to be talking about non-alcoholic fatty liver disease. It's thought to be one of the more, perhaps the leading cause of liver failure now. I'm seeing a lot of patients in my clinic with this disorder, and it's a fairly complex disorder. I think there are a number of theories in terms of the multiple mechanisms, and we're going to get into this. I think this is going to be a very important topic for you. And of course, most of you are taking the holiday off and enjoying your weekend, so maybe you'll be watching this on recording. But however you get this message, I think it's going to be very important to make a note of it. We're going to give you a lot of practical insights and ways of having your own health evaluated for this disorder. And of course, always pass this information on to loved ones. So sit back, relax, get your pen and pencil ready to go. We have a lot of information for you tonight. Okay, and welcome back. Welcome back. So, as I said, we're going to be talking about non-alcoholic fatty liver disease. I have on the show with me friend and colleague Sosa.
Hello.
Ms. Sosa, how are you this evening?
I'm all right. I'm okay.
Now, you've been all over the world between here and the continent of Africa. So, where are you now?
I'm in Fairfax, Virginia.
Okay, Fairfax, Virginia. Okay, great. Yeah, how's the weather out there?
It's interesting. It's a little temperamental, not as warm as Houston, but it's been warmer the past couple days.
Wow. Wow. What are some of the low temperatures you're getting there?
I think we were even getting like a 59, 60 on certain days.
Okay. Okay.
Yeah, so it's not that bad. I like it a little bit warmer because I just came from Africa and it was like scorching hot, obviously. So for me, it felt cold when I got here.
Yeah, you get acclimated to the heat and you come down to 60 degrees, makes you shiver.
Yeah, exactly.
Yeah. So anyway, as I said, this issue of non-alcoholic fatty liver disease is I think a very important issue. You know, and I know in your consulting practice, you see a lot of patients with chronic illnesses, and certainly in my medical practice, people with heart disease. They don't come in just with heart disease; they come in with a package of disorders. And there are certain organs that are very important, that are central to the body's overall machinery and mechanism, and the liver is probably as central as organs get. It's the metabolic machinery. It's where the body manufactures protein, hormones, nutrients. It has an important role in the immune system and the like. So when the liver is compromised, you can see other parts of the body's function compromising. And I think if we understand that concept, I think it's going to help us understand some of the phenomenon that's related to non-alcoholic fatty liver disease. So what I'm going to do for the first part of our discussion is to go into an overview of non-alcoholic fatty liver disease. I'll make some comments on benefits of omega-3 fatty acids in the context of non-alcoholic fatty liver disease. And then we'll take a break and then come back and just have a discussion about this. And I'd like to get your intake on this as well as Sosa. So just to get started, non-alcoholic fatty liver disease. So what is this phenomenon, and what do we need to know about it? In essence, it's characterized by excess fat accumulation in the liver, hence the name, fatty liver disease. Now, the non-alcoholic is an important part because, I think most of us are aware of the adverse effects of excess alcohol consumption on liver disease. And so we're accustomed to, knowing about someone who's chronic alcohol consumption, who then develops, liver cirrhosis and therefore, advanced liver disease and the like. And so the non-alcoholic fatty liver disease is categorized as a separate entity because this whole class of liver disease is associated with multiple factors that one cannot necessarily pinpoint to one etiology, such as alcohol. It's estimated to affect about 10 to 35% of the adult population worldwide. Most common cause of liver disease in the United States. And it's independently associated with a risk of cardiovascular events and increased mortality. Now, the increased risk of cardiovascular events, I'm going to, share some of my thoughts on that in terms of how that might be the case. Studies show that those with non-alcoholic fatty liver disease consume about 27% more meat compared to with the general population. So that's something to, hold on to as we talk about the pathophysiology here. Triglycerides and other fats accumulate in the liver with excess dietary consumption. So, that's sort of a first hit mechanism, is accumulation of liver in the dietary area. This impairs the ability of hepatic cells to take up glucose. So fat accumulation resulting in insulin resistance. And then here we go with the mitochondria again. So the mitochondria, which are the powerhouses of cells, they become impaired. Now, if you remember from our previous discussions, and again, I'm always tie in these, common mechanisms. Previous discussion, we talked about inflammation of the heart. We talked about inflammation and kidney disease and previous discussions. Here we have inflammation with the liver and mitochondrial impairment. If you remember from our previous discussions, is associated with increased reactive oxygen species. These increased reactive oxygen species are like, cause oxidative stress, which, can contribute to ischemia, contribute to inflammation. And here you see this association with mitochondrial impairment associated with fibrosis. So that same common mechanism, increased oxidative stress, increased inflammation, and increased fibrosis is happening here in the liver, similar to where it happens in the heart and other organs. Furthermore, you have fat tissue accumulation in the liver. This represents it results in a release of pro-inflammatory and prothrombotic cytokines, IL-6, TNF alpha. Again, remember these cytokines. We talked about increased inflammation of cytokines and inflammation of the heart, increased inflammation of cytokines and other types of inflammatory conditions. And so here we're dealing with the same underlying mechanisms. And so when we talk about, say, disease A versus disease B versus disease C, and we say, well, the same mechanism are involved in disease A versus disease B versus disease C, then it's important to understand that these diseases are very similar. And to some extent, we can, consider them as the same disease. They have the same underlying manifestation. Now, this same underlying inflammatory process, excess cytokine release associated with that, in one individual may manifest as heart disease, and another individual may manifest as liver disease, someone else perhaps kidney disease or the like. And so, we have to consider that, hey, wait, there's the same underlying mechanism. It's just that one person may be predisposed to a hepatic manifestation versus a cardiac manifestation. So here we have the same mechanism that we talked about before. Excess adipose tissue in the liver also reduces release of anti-inflammatory molecules like adiponectin. So there's an overall systemic increase in inflammation when you have this process of underlying non-alcoholic fatty liver disease, which is resulting in these mechanisms. So here's an overview, and oftentimes a picture is worth 1,000 words. You have hepatic insulin release. Okay, and that's increased gluconeogenesis or glucogen production, exaggerated lipogenesis and inflammation. That's happening intracellularly at the hepatic level. Muscle insulin resistance, abnormal myokine levels. So you have insulin resistance at the muscular level that is associated with hyperinsulinemia, which further feeds into this increased hepatic insulin resistance. You have more adipose tissue insulin resistance. Lipolysis, free fatty acids are released systemically, which cause systemic inflammation. You have abnormal adipokine levels, which is has a hormonal factor associated with this metabolic process. Further inflammations occurs at the gut level. Patients with non-alcoholic fatty liver disease has the leaky gut with that's associated with dysbiosis. Now, you can question again with the initial hit mechanism being poor dietary intake. Are you developing dysbiosis first, or is one of the earlier mechanisms with leaky gut and a systemic inflammatory process that then hits the liver systemically? That's certainly a possible mechanism. So we're talking about association. So leaky gut being associated with non-alcoholic fatty liver disease could be a mechanism by which the leaky gut may be contributing to it. So it could be an early hit mechanism and an early pro-inflammatory mechanism. Overnutrition, as we alluded to earlier, increased take of fructose and sucrose, as well as increased intake of saturated fats. There's a neurohormonal component that's likely mediated by certain hormones. Satiety and preference appetite is associated with these neurohormonal levels, and increased fructose on the nutrition level contributes to the neurohormonal effects. Another aspect of the pathophysiology I wanted to outline is the progression of liver disease. Now, it doesn't necessarily progress in this order that I'm showing you, largely because we make the diagnosis at different levels. So we don't always see this progression necessarily, even though it may progress. So for instance, here you see a normal liver and the first hit of insulin resistance that's likely mediated by dietary consumption. But I don't want to leave out pharmacology, even though it's not in this diagram. Polypharmacy certainly contributes, I think, as a first hit mechanism, or potential as a first hit mechanism to transfer from a normal liver to a diseased liver. So you can have a disease process where you have macrovesicular steatosis, so just fat accumulation in the liver cells. Or in some cases, we see what appears to be a progression straight from a normal liver to fibrosis. So you can have just early fat accumulation without fibrosis, or a combination of fat accumulation with fibrosis, and whether or not you can jump from normal to fibrosis with fat accumulation, or you progress with fat accumulation first and have fibrosis second, is thought to be two possible mechanisms. I can see how the fibrosis can occur with fat accumulation, independent of just fat accumulation only, because if you look at our initial mechanism, poor dietary intake or pharmacology, and you look at leaky gut, the leaky gut is releasing molecules that cause systemic inflammation, and therefore you have a result of inflammation of the liver. So you have more fibrosis, which then leads to advanced scarring, which we consider cirrhosis, and then hepatocellular carcinoma. Now, again, does it always go to hepatocellular carcinoma? Not necessarily. In fact, sometimes you can have hepatocellular carcinoma be an early hit mechanism. And so, and you can also have non-hepatic cellular carcinoma, other cancers contributing to this process. Why would that be the case? Well, if you have early hepatic dysfunction, because think of it as this way, you're getting hepatic dysfunction early on, even with macrovesicular vesicular steatosis and early fibrosis. So in these early stages, you're getting impairment of liver function. So when you have impairment of liver function, that's also a suppression of the immune system. We have a suppression of the immune system that predisposes to infection and also cancer. So early on, you can get a secondary effect due to early hepatic dysfunction. We know that vitamin D is metabolized in the liver, so you have impaired vitamin D metabolism. We know that antibodies are formed in the liver, so you have impaired antibody formation, and there may be other systemic mechanisms that's impairing the immune system outside of the liver. So this early phase can jump clearly to either cancer of the liver, or it can jump to cancer of, say, the colon, metastasis of the liver, that then will lead to this progression. Not to overlook that the individual may continue to consume toxic chemicals such as toxic foods and toxic medication that further impairs liver function. So you can get severe hepatic dysfunction early on, even before you have this pathophysiological progression. So that's why the progression is not as orderly and neat as this diagram shows, because you have multiple hit mechanisms that are occurring simultaneously every stage of the way. And I hope I didn't lose people. I hope, get your questions ready regarding that. Clinical overview, what often is considered, they think of cardiometabolic outcomes. So some of the manifestations leading to poor health and death of patients with non-alcoholic fatty liver disease, cardiometabolic causes as the highest contributing factor. Oncologic and primary hepatic dysfunction are also categories that are considered the major categories that we consider. I will mention that from a cardiovascular standpoint, certainly in my patient population, I see a lot of patients with cardiovascular dysfunction, such as advanced heart failure, which leads to congestion of the liver. So you can have what we call as a congestive hepatopathy. So we have increased pressure on the liver due to poor circulation or increased right heart pressure, secondary to increased left heart pressure, secondary to heart failure, or weak left heart or stiff left heart. You can have congestive hepatopathy. You can also have patients with valvular disease, such as tricuspid valve disease or pulmonic valve disease, that again results in backflow congestion, and you can have liver cirrhosis as a result of that. So we see it's common in my situation. In fact, all my heart failure patients are evaluated for underlying liver disease, even though they may have normal liver function tests, because we're looking for a cardiovascular contributing factor to hepatic dysfunction. So having said that, patients coming in with standard chronic metabolic disorders. So let's say someone is obese with metabolic syndrome, has insulin resistance, but they also have heart failure, because the same mechanism causing insulin resistance or causing diabetes is contributing to heart failure, giving them coronary disease, heart attacks, but it's also directly affecting the liver through the same mechanisms that we described. So you have someone with cardiovascular contributions to liver cirrhosis or fat accumulation in the liver, plus direct metabolic contributions to it. And so the liver is getting it from every angle, if you will. So some people looked at the role of omega fatty acids, and we'll talk about this briefly and kind of give an overview of nutrition as it pertains to omega fatty acids and in general. And I'll share some of my thoughts and get Sosa's comments on this in our next session. But omega-3 fatty acids include polyunsaturated fats derived from alpha-linoleic acid, pentanoic acid, and docosahexaenoic acid. And these are fatty acids, ALA or alpha-linoleic acid, found in land plants. EPA and DHA are found primarily in algae and fish, but the fish get it from the algae. So essentially it's found in sea plants. So the way I like to think of it is ALA is found in land plants, and EPA and DHA are found in sea plants. EPA and DHA are anti-inflammatory and found in algae. Our body can convert ALA to EPA and DHA. Some people convert it better than others due to perhaps genetic differences. Plant foods like chia seeds, flax seeds, chia seeds, walnuts, and vegetables are also good sources of omega-3. So I tend to tell patients to consume a good amount of land plants and a good amount of sea plants, i.e. algae. Say blue-green algae or microalgae and the sea vegetables, larger sea vegetables are macroalgae. Omega-6 include polyunsaturated fats derived from linoleic acid and gives rise to arachidonic acid, which can be pro-inflammatory. So you need a proper balance of 3 to 6. The pro-inflammatory effects are beneficial because the body do need some ability to create inflammation, but it has to be kept in balance. And so the optimal ratio is thought to be 3-to-1, omega-6 to omega-3. And higher than this ratio can predispose to excess of inflammation. And a lot of people in the standard American diet are getting an excess amount of omega-6 compared to omega-3. And so the total amount of omega-3 acid is crucial to reduce oxidative stress. So what are the effects of omega-3 on lipid levels? Omega-3 acids have an effect on gene expression. So there's a genetic mechanism. It causes a reduction in production of endogenous fats and a breakdown of dietary fats. So omega-3 acid can increase the action of the peroxisome proliferator activator receptor alpha. This causes a breakdown in fats, and it causes a stop in progression of reverse fatty liver disease. There's also an effect on the gene transcription factor of the steroid regulatory element binding protein 1, or SREBP, to reduce lipid production by the liver. Suffice it to say, there's a genetic mechanism at which the omega-3 is working to have an effect on liver fat metabolism. Omega-3 acids also affect molecules across cell membranes. So the transporter molecules across membranes and the similar fashion transporting glucose across cell membranes can be enhanced by omega-3. So it can improve insulin resistance, possibly independent of insulin levels. And so since glucose going into cells, the liver will not be triggered to produce or release more glucose or triglycerides in the bloodstream. So increase omega-3, increase glucose transport. So having a counter effect on insulin resistance. Now, the one mechanism that's thought in which it lowers is that it lowers serum triglyceride levels and glucose. So that decreases fatty uptake. It can reduce LDL and VLDL and increase HDL. Omega-3 also reduce inflammatory markers like TNF alpha. And these inflammatory markers, as a reminder, serve as signaling molecules to trigger more inflammation. So it can interrupt that cascade of inflammatory molecule stimulation. So omega-3 fat increased nitric oxide release from the endothelium. That has benefits from a cardiovascular standpoint, which is important. So consuming omega-3 fatty acids, good sources, as we alluded to, flax seeds, chia seeds, walnuts, of course, sea vegetables like algae, also good sources. Broccoli, spinach, cauliflower, Brussels sprouts, bok choy, turnips, edamame are also good sources of omega-3 fatty acids. Now, people like to talk about fish consumption, and fish has high levels of omega-3 fatty acids. Remember, the fish get it from the algae. Not only that, the fish has a lot of bad molecules in. Fish consumption is associated with increased trimethylamine oxide, which is associated with transporting bad lipids, cholesterol, and promoting atherogenesis at the endothelial wall, in the endothelium and the arteries. So the negative aspects of consuming fish outweigh the positive. There's a review of 27 studies show increase in plant-derived sources of omega-3 reduce cardiovascular disease by 10%. So, in conclusion, overall lifestyle change are the best way to currently help prevent and reverse non-alcoholic liver fatty disease because liver disease worsens in metabolic syndrome. So, again, the nutritional approach is going to be the ideal way of doing this. Lifestyle change, reduce fatty liver acids, avoid processed foods that contain trans fats, avoid high amounts of saturated fats, avoid processed sugars, excess carbohydrates, lose weight, eat a diet rich in antioxidants, and consume omega-3 fatty acids. And I would even argue the optimal lifestyle helps reduce the requirement of pharmacological agents. That's not listed in the usual article or review articles that you'll look at when discussing this. However, I think it's an important thing to consider because we often are quick to take an over-the-counter medication, whether it's acetaminophen or some other agent or drug, and we need to keep in mind that these drugs, many of them, most of them, have to be metabolized through the liver. You can have an adverse effect on the liver. Also, chemical preservatives. So you may be consuming food that are quote unquote thought to be healthy, but processed oils and other processed foods with chemical preservatives, dyes, or the like can also have an adverse effect on the liver. So we want to keep these things in mind in addition to the food. So you want your food to be pure and natural and not overly preserved, etc. So what I want to do is take a quick break here. And Sosa, I want to get your take on some of these concepts, and then we'll also hear from the audience in the chat. So as we go to break, I want you guys to take a break, hit the thumbs up, show us some love with the thumbs up. Also, please subscribe if you haven't had a chance to, and share this important information because non-alcoholic fatty liver disease is a very common disorder, and it's like a thief in the night. It can sneak up on you. Many doctors don't screen for this. They check liver enzymes, and they may have you on a lot of medication that are metabolized by the liver. And they say, well, the enzymes are fine, so the liver is fine, but that's not necessarily the case. So give us a thumbs up. Please subscribe if you haven't had a chance to, and share this information. We'll be right back. Okay, welcome back. And again, happy Memorial Day to everyone. JW, Jackie's reminding us that we are the home of the free because of the brave. And I want to remind people today is a special day to celebrate those who paid the ultimate price, for our freedom. And we pay homage to them. And good evening, Catherine and Gray.
Thank you.
See, they didn't say anything about me. I'm not going to try to elicit any comments there. Good evening. Okay, great. And so, anyway, it's also. What are your thoughts on this topic?
I have so many thoughts, but I liked your presentation. I really am really glad that you brought up meds because I feel like
thanks.
Like doctors give people meds who have issues with their liver, and it's like, but the liver needs to clear those meds. And I feel like the average person doesn't really think about that at all. I mean, the things that I think about as a nutritionist when someone has fatty liver is basically their liver has now reduced capacity to detoxify. So I'm trying to figure out how to help the liver detox, get back to normal functioning in that way. I also think about the fact that when you have fatty liver, you can have excess levels of cortisol, which can also kind of tie hand in hand with that adrenal issue. So supporting someone's adrenals if they seem like they might have that issue. And then what comes up a lot in my practice is also the liver clears estrogen. And so if they're having fatty liver issues or liver issues in general, they can have excess estrogen or estrogen dominance. And then in my clients, I see the growth of the fibroids or cysts or all these other things. So I think about all those things. And then also, I don't know the actual, you could probably break down why this happens, but as far as I know, I think it also reduces bile production in general when someone has fatty liver, which that means they may not be able to absorb properly vitamin A, D, E, and K, those vitamins and omega-3s. So you have to kind of change their diet, manage their blood sugar, manage stress. There's so many things. It's really just it's a lot of depends on the person.
Yeah, the fibrosis will contribute to biliary congestion, and so bile flow can be impaired, and of course the metabolism can be impaired because again you have hepatocellular dysfunction, so the cells are not able to carry out their normal metabolic processes, and the association with cardiovascular disease, again, the body. And the way I think of it is that you have a biochemical milieu that exists within the body, certainly in the bloodstream and the lymphatics and other parts, other channels that we probably don't look at on a regular basis. And so in this milieu, it becomes unbalanced or abnormal in the setting of hepatic dysfunction. And in that setting, as you pointed out, you don't remove toxins very well, so there's a toxic buildup. And so with that toxic buildup, you have a situation where you have organ dysfunction. So, hepatocytes, cardiomyocytes don't function very well in a toxic environment. Renal cells don't function well in the toxic environment. We talked about diabetes and insulin resistance, previous week. So you have an impairment of pancreatic function in a toxic environment, associated with increased inflammation, as we talked about. So these similar mechanisms are occurring in the setting of liver dysfunction because, again, as you have toxic buildup, the gut microbiome is impaired, so you're releasing more inflammatory molecules through the gut, and therefore, more systemic inflammation. And you have this negative cascade of events: increased oxidative stress, increased inflammation, and those two common hit mechanisms, which probably undergirded by dysbiosis, and then you're off to the races. And unfortunately, many people live in this chronic debilitated or chronic progressive debilitated state for a long time. And in our typical medical therapy, we're just treating outward symptoms. Someone has a little bit of swelling, we give them a diuretic. They have a little bit of ache, we give them a pain for ache, and we're just throwing medications, superficially treating symptoms while ignoring this underlying metabolic process. That if we attack it from that approach, we can make a major difference. And that's why, certainly in my practice, I imagine your practice, it sounds like a broken record: nutrition. And we promote, plant-based nutrition, as we outlined, omega-3, the best sources of plant sources, as well as anti-inflammatory molecules, best sources being plant sources. And I like the raw plant sources because it helps from an inflammatory standpoint. Outlaw mentions the concept of sugar. So it says people used to eat about 24 pounds of sugar a year. Now we eat 180 pounds or more yearly. And he says that's your liver issue right there. So what are your thoughts on the sugar issue?
Well, sugar is in everything. There's too much. If you're eating processed food, you're likely eating a lot of high fructose corn syrup, which could definitely contribute to fatty liver. But it's really important that I'm always trying to educate my clients to read labels and really understand what's in their food and pay attention to the number of grams of sugar. And if they need to go on a quote unquote sugar detox, they should. But it's really best to focus on getting non-refined sources of sugar. So actually getting it from fruit or, something that comes with fiber as well, so that your body can digest it as better. But in general, if you're dealing with someone who has fatty liver and maybe they have adrenal issues, managing their blood sugar levels is so important. So reducing the overall intake of sweet foods is very helpful. And a lot of people don't want to do that, but it makes a very big difference. Again, tied to your talk last week about insulin resistance, but it makes a really, really big difference in weight loss, in people's moods, in their energy levels, all of that.
Yeah, I think you're right. And going on a sugar detox, we're actually starting to create sugar detox um, protocols, because we're recognizing that, you know, because, we all on the standard American diet get, so accustomed to these processed sugars. Even when we go on a raw plant detox, even though we're consuming plant originated sugars, which are healthier, I think, than the processed sugars, it's likely or possible that in certain situations, maybe in non-alcoholic fatty liver disease, the early stages, maybe other conditions, cancer, other conditions, inflammatory conditions, et cetera, excess yeast formation, and many of these may be connected. It may be important to detox on sugar itself, and so sugar of any kind. So, sometimes, sugar detox for 6 months, 12 months, et cetera, can be beneficial in a lot of ways. So it can be tough, though. It can be tough.
Very tough. I think that also ties into your connection of the fatty liver and dysbiosis or leaky gut and stuff, because people are consuming so much refined processed stuff that their gut then gets compromised, and then that continues problems for them, basically. So just getting rid of some of those sugars, at least they're not contributing to the growth of candida or parasitic infection or all these different things. It can be very helpful for just clearing the gut issue in addition to resolving the fatty liver.
Yeah, I think you're right. And again, and we're talking about just basic fundamental things. We can come up, there's some data, I didn't go over it in my presentation. It talks about, drugs that can be used to in NASH. Pioglitazone is one drug that was mentioned. But I intentionally stayed away from it because there's so many natural things that could be done. And if you look at the pathophysiology and the mechanism of the onset of this disease syndrome isn't a deficiency in drug X, Y, or Z. It's a metabolic insult. And so the treatment should be to remove the metabolic insult.
That's really dope what you just said. Whenever we talk about things like this, it always makes me think about how I feel like diagnoses are not very helpful.
That's right.
Right? Because it's just this term, a label, but it's not really getting specific to all of the issues that one person has that is contributing to the symptoms they're experiencing.
Well, I agree with you 100%. And not only may they not be helpful, and sometimes they can be harmful in the sense that it creates a labeling process where we say, okay, NASH or NAFLD or whatever the case is.
Right.
It's okay, this drug's good for that, that drug's good for that. And it creates, or causes clinicians to not think about the underlying process, to overlook the underlying processes. So I think it's one of those things that, you're right, where we have to say, well, wait a minute, are we thinking about a disease label? Let's talk about the pathophysiology. And as we went through, was associated with processed food intake. Well, why aren't we doing research to remove processed foods and processed carbohydrates?
Exactly.
It's a simple approach.
Exactly.
Outlaw also mentions milk thistle and turmeric, which have been shown in the literature to have great for rebuilding the liver. Your thoughts on this?
Yeah, milk thistle is an herb that is definitely known for liver cleansing. I don't know about turmeric. I know for the liver, it's anti-inflammatory in general. When I'm trying to help someone increase the functioning of their liver, I immediately use castor oil packs, I wish I really like for many things. But castor oil packs, castor oil is one of the only oils that goes beneath the dermal layer of the skin, can help reduce inflammation, can help detox organs. It really does help my clients, especially who have hormonal issues and they can't get rid of the excess hormones.
Mm-hmm.
So I really like castor oil packs. And then, sure, you could work with certain herbs. I did work with milk thistle, or I had a client who had fatty liver who did take milk thistle at some point. But is that one herb? Or you can't use the herb like a Band-Aid. You really do have to look at your diet as well.
Yeah, I think I like to use herbs as an adjunct to an underlying diet. If you don't, if you're not really, if you have advanced, liver disease, fatty liver, inflammation, etc., you need to be on an aggressive diet. In fact, oftentimes what we do is we'll start patients on a nutritional detox diet, and then at the same time we'll then add supplements or targeted nutrients, say in week 1 or 2, to emphasize the importance of the nutritional intervention. And so that's certainly one with an importance. I think one of your clients here is giving a testimony here.
Thanks, Pat.
Castor oil packs and supplements. So good. So that underscores what you were just talking about. No one's deficient in any big pharma compounds, but people are deficient in vitamins and minerals, and deficient in optimal nutrition. So yeah, we in allopathic medicine has this approach where it's like, okay, let's find a drug or something that's the magic bullet. And there was one study, I think there was a study looking at the GLP-1 agonists, and it showed, a reduction in progression of cirrhosis in about 39% of the patients who took it, compared to 9% in placebo. However, you say, well, 39%, well, what happened to the other 61%?
Right.
And so, but I think if you use an aggressive nutritional regimen, you'd have a much higher percentage of success. And so I think that's certainly something that we need to keep in mind with, in our approach to treating this, which I think, when you really think about it, this is a pretty ominous type disease. We have someone who has who has kidney failure, you can have dialysis, heart failure, where you can maybe have a transplant, etc. Liver failure or an LVAD, but liver failure, you have to get a transplant. Now, fortunately, someone can get part of a liver and transplant it, but then you're, tied to immunosuppressive drugs for the rest of your life. So you want to try to really avoid these advanced therapies. And our experience has been, hepatic liver dysfunction is very easy to treat with a nutritional intervention. It responds very well to nutritional intervention. I think the difficulty is getting over the psychology of people wanting to consume these liver toxic foods and therefore needing to consume liver toxic drugs. It's like alcoholics. We talk about alcoholics who are addicted to alcohol, and they continue to drink despite the fact that the liver gets worse. Right. But a patient addicted to baked chicken continue to eat the baked chicken despite the fact the liver gets worse. And so, even though this is considered non-alcoholic fatty liver disease, both alcoholic and non-alcoholic liver disease, in my opinion, could be attributed to substance addicted liver disease. And so substance addicted liver disease is alcoholic and non-alcoholic combined, because it's related to people's addiction to either bad foods and subsequent requirement of medications.
We've seen that the liver can generally regenerate itself and people can improve, but from a medical perspective, when is the point of no return? Like, when can someone's liver just be like, oh, sorry?
Yeah, that, it's interesting. Really advanced cirrhosis is when you're in a situation where, I don't really like to say a no return, because I honestly don't know where that is. And the reason I say it is the following, because I've had patients who have severe, liver cirrhosis dysfunction, and when they are very aggressive in nutrition and many other things that we implement, they, even though the liver function may not return to absolute normal function, but it recovers to a point where it's sufficient. And so it's, I had a patient recently, was in the hospital, had, bad liver dysfunction, and he was, 80 years old, a lot of metabolic problems going on. And, I put him on a raw plant-based diet. And, he's being dialyzed, and we were going to do some other things. We reduced his medication consumption to put less stress on the liver. But, I got pushback, from family members. Even the patient was alert enough to say, well, I want, pancakes and syrup, whatever, the processed syrup. So even from the patient on his deathbed, the psychology of I want these foods was so strong that, so I think overcoming liver cirrhosis isn't the problem. It's this overcoming the addiction of the patient is really the problem. And they come up with all sorts of reasons like, well, I'm such and such years old or whatever the case is. But yet we're pouring in blood transfusions because they're bleeding out, or we're doing other things because they're bleeding out, but yet they're not willing to make that sacrifice of making the nutritional change. And then the entire milieu of the medical community is not insightful enough or knowledgeable enough about nutrition to emphasize the need for that change to be made. If someone's an alcoholic with alcoholic liver disease and they say, well, I want to drink, I mean, everybody said, no, you can't have a drink. But somebody with, processed sugar mediated, dead animal flesh mediated liver disease says, I want some bacon, eggs, and pancakes. They said, sure, have bacon, eggs, and pancakes. Yeah.
Right.
And so it's really, in my experience, I mean, I've seen people with pretty advanced liver disease, when they do the right thing, turn around. So I haven't really seen that or been able to identify that absolute demarcation. And maybe that absolute demarcation is at the absolute demise of the patient. Because when the liver completely goes kaput, the patient dies, you have excess acidosis, et cetera, and then you can't turn it around. But I think if you do the right things, even when advanced, as long as the patient's alive, there's some hepatic function that's adequate to where it can be turned around. And so that's my experience. And maybe, later on I'll have a different answer after I've looked at the patient. But I really think we need to, in fact, this whole discussion is stimulating me to talk to some of my colleagues who are hepatologists. And I would like to maybe place patients on a plant-based diet. We could probably do something where we, I can provide the food and they can follow the hepatic progression. Kathy says, I was diagnosed with a fatty liver a few years ago, was never followed up. Is this something I need to take serious and see my gastro? I think so. I think we'll definitely take it seriously. And the course of liver disease progression varies from person to person. And certainly Kathy Cravero, that the last name seems like a Hispanic surname. I don't know the background, but the genetic predisposition for non-alcoholic fatty liver disease is higher in people of Hispanic origin, particularly Mexican Americans, compared to people of African origin from a genetic standpoint. And so the data shows that. I didn't put that in my presentation, but that's something that we should all be aware of. But that's clearly something that you want to okay, Cravero, she's Italian. Okay. So Italians are probably intermediate. sorry about that. I hope I didn't. But anyway, so Gina O'Neill, Zeolite Extra is a great place to start. It's amazing to flush my glands. Absolutely amazing. Zeolite removes heavy metals from the blood. You want to take it probably at night, sometimes in the morning, away from taking medications.
What is this, Dr. Montgomery? I don't know what zeolite is.
Yeah, zeolite is it's a combination of volcanic ash and sand, and it forms a honeycomb-like molecular structure that attracts molecules, positive ion molecules, it's along the same um, nutrient mechanism, I should say, as things like diatomaceous earth or other
Okay, it's
heavy
like
clays,
bentonite clay or diamine.
bentonite.
Okay, I know those.
Exactly.
Okay,
And so it behaves like those molecules in terms of extracting ions and the like.
okay.
So anyway, so the thing is that yes, Kathy, do follow up with your gastro, but also Kathy, if you're not on a plant-based diet, I would recommend doing that. You can also do a raw plant-based detox. Many people can get blood tests from any labs anywhere. We measure not only liver enzymes, but we look at albumin level, we look at ammonia level, we look at the PTNINR level, and so that's something that we look at to evaluate hepatic function, which can also be helpful. And there are other criteria that you can look at, platelet levels and the like. So
And
all of
I'll
these
just
things are
add
important.
a different perspective, Dr. Montgomery. Don't be
Mhm.
mad at me. I've actually had more than one client with fatty liver who I made go on a high plant-based diet, and they occasionally wanted fish or whatever, and they still were able to make great progress.
Mhm.
So, don't shoot yourself in the foot if you can't do a whole thing, but we highly recommend, obviously, you get as aggressive as possible. But for some people, they can still do really well over time, with some major changes just by increasing the amount of plant-based foods they're eating.
Yeah, and I think moving toward a plant-based diet is critical. What I do is, and you're right, if someone goes from high processed foods and terrible things, and it goes more plant-based and having a little fish, you can see improvement. The only reason I just try to speak in the absolute, because my experience, and you give them an inch, they take a
A
mile,
mile.
and by the time they're seeing me, they have a severe advanced disease,
Right.
and so there's little room for kind of, there's less wiggle room. I'll put it that way.
No, I agree with you, because so people usually, by the time they're seeing you, they're in real trouble. When they're seeing me, usually they're in trouble. So they're
Yeah,
not like all
yeah, they have more wiggle room. Yeah.
Yeah.
Um, I'll start a plant-based diet. Thank you. Plus, I'll make an appointment with my doctor. All right, thumbs up for
Good job, Kathy.
Kathy. Yeah, I think doing both, because you're taking the process in your own hand. You're doing something that's simple and straightforward, and then you're following up with your doctor. Freedom talks about fatty liver disease. Candida has invaded the liver and precipitated immune response. That's certainly a possible mechanism, or any infection of that type. And an infection can trigger a systemic inflammation, so it doesn't have to have Candida infiltrating the liver, but it can have a systemic inflammatory response that can indirectly affect the liver and cause immuno disarray. Gina, I'm down 190 pounds. I changed everything. I had fatty liver, did scans. They said my liver is amazing. Congratulations, Gina. Again, an underlying testimony as to what you can do. Again, this channel is about empowering you to make the changes that can really turn yourself around. And oftentimes we are, we're historical. We go to the doctor, we get diagnosed with heart failure and diabetes and liver dysfunction, all that, and everybody come, all in disarray. But I'm here to tell you that these diseases are not as bad as you think. Now, they can be bad, because if you continue to cause them or contribute to them, but by simply change your diet and your lifestyle, you can make a major impact on your life overall. Zeolite, an amazing detox substance to keep on your diet. I use powdered form. We use zeolite in some of our detoxes. Marine phytoplankton is the best source of plant-based omega-3s I can find. Let's see, Kathy Craver, are you saying fish is not good then? I eat salmon or other fish. Does that? I'm going to just now say don't eat fish. I mean, I think especially, I think you should do 4 to 6 weeks, 100% raw plant-based foods, and give yourself the best chance to turn things around. I mean, Sosa has an experience with patients. They do well without it. I mean, sometimes, if you drive without your seatbelt, you won't have a wreck and won't get but I just don't advise. I mean, I've driven a few short blocks without my seatbelt, and I've made it there safely. But I mean,
well, here's the thing, Dr. Montgomery. So when I'm telling somebody that they could eat fish, I'm not actually doing it randomly. I'm actually looking at their body type, like their Ayurvedic body type. I'm looking at their genetic background. Kathy said she's Italian, the land of the Mediterranean diet. But I do think that she should. The thing is that you have to stop the bleeding like like you do, which when people are having really, really horrible situations. The detoxifying diet of like having a raw diet or having a fully plant-based diet is very necessary for a lot of people, because it's like you've spent 40 years pummeling your body with a bunch of stuff that is not helpful. I do find that sometimes, based on certain people's body types though, that they tend to feel like, oh, I have to have, and I'm like, well, you don't really, but these are the things that could work for you based on your genetics, where you're from, and some of the stuff is sentimental. It's like I grew up eating this thing, and so now I have emotions attached. So as a nutritionist, I always to keep those things in mind, but I do look very carefully at, does this person need this? I've also noticed, strangely enough, I've had a few, like, I generally treat hormonal imbalances, like, with plant-based diets, because it works really well. But then I have these random type O's who actually are hormonally imbalanced and they're plant-based. And when you start actually allowing them to eat some fish, they stop being hormonally imbalanced. And I'm like, well, that's weird. Like, so I don't know. For me, there's not always, when I've seen a lot of patients, it makes me always feel like there's never one cut and fast, dry rule. I have to look at that specific person. But I do agree with you that, like, you need to detoxify. If you're in a really serious situation, you should be detoxifying regardless.
Yeah. The best food is, and even if you look at, animals outside the human animal kingdom, dogs that are natural carnivores. So these are natural carnivores. When they get really sick, they go to plants only. So fasting and plants only. So
right.
Even in that setting, it's kind of an original food. Any final thoughts or comments as we close out? Get ready to close out, Sosa.
No, not really. Besides the fact that I think this kind of goes back to the general theme of, you got to manage your blood sugar levels, eat real food, deal with your stress, move your body. I mean, it feels like we just say the same thing.
Yeah, no.
Yeah.
We're trying to come into different ways of coming into the same
different
thing.
angles. Yeah. We're saying the same thing, people. We're saying the same thing.
Yeah. It's funny. It reminds me, I was in medical school, and we were in class, and I was one of the professors he had a slide up, and he was making a funny commentary, and the slide had a cartoon, and it had, it was a veterinarian, a diagnostic and treatment book, and then it had all of these different diseases in terms of how to treat, let's say, a horse with, disease 1 through 15. And all the diseases, you had the same treatment: shoot. In other words, they use euthanasia a lot in animals that have these certain diseases. But anyway, it sort of reminds me of what we do. It's okay, disease 1 through 15, plant-based diet, exercise, fresh air, sunshine, et cetera, et cetera. But
exactly.
Anyway, but no, thanks a bunch. Good to have you on the Sosa. I will see you backstage as I close out. As always, I enjoy and I learn a lot in this discussion, even as we're presenting information. I learn from your questions and comments. And this non-alcoholic fatty liver disease condition is one that is very problematic and is on the rise. So again, share this information with loved ones or friends, anyone who you think may benefit from it. And of course, if you haven't had a chance to subscribe, please do so. And again, give us a thumbs up, show us some love. And until next time, keep it fresh, natural, and live.